As a parent of a complex autistic child, you want to fix things as fast as you can, especially when you think your child might be in pain. Now, one question I often get asked is, what can I do to help my autistic child now? What can I do to get them to a place where things aren't so stressful? Well, in today's video, I'm going to give you the #1 thing that you can do to help your child immediately, and you can start today. I'm gonna tell you exactly what this one thing is, why making this change works, and how to implement it today. This single change has the potential to make a huge impact, and that impact is more significant than therapy, medication, or any intervention. So let me tell you what it is. For those of you who are new here, hi, I'm Dr. Dana Johnson, an occupational therapist with a PhD in child mental health and development. And I help parents navigate complex autism and learn what is really behind some of their biggest challenges. Okay, so what is that one thing that I'm talking about? Well, it's ultra-processed foods. And when you think about ultra-processed foods, you probably think about things like chips, right? Chips or soda or things like that, where you go to the junk food aisle and that's just the things that are just bad for us. And yes, you're partially right, but something that you may want to know is that there's actually 4 different groups when we're talking about processing. So let's go through them quickly, just so then you can be a consumer who is well informed. So group #1, we call this whole foods. Okay, so whole foods are things like apples or avocados, things that you get that actually are one ingredient. They don't have a long list of ingredients on their package. Okay, group #2 is what we call processed culinary ingredients, things like olive oil or oils, honey, maple syrup, things that we add as more condiments, right? So they do have a little bit of processing to them, but not as much as group 3. So when we're talking about group 3, we think about things like canned foods. Those are still processed, but there are things like canned foods like canned fish, canned vegetables, canned fruit, but also bread. Bread is considered in the processed food category. Now, finally, group 4. Group 4 is what we think of when we're talking about the chips, the soda, the any kind of packaged dessert, the cakes, the pies, all of those things that you buy, those are considered ultra-processed foods. And those are the things that are the worst for us. Now, when we're thinking about, okay, what should we buy when we're going to the grocery store? We need to think about things with the least amount of ingredients. So if there's a long label to it and all of these ingredients that you cannot pronounce, that's a warning sign that this might not be good for you, and it is an ultra-processed food. Next, we have what we call high fructose corn syrup. Now, high fructose corn syrup is actually the thing that makes these things addictive. So when I hear parents say they love carbs, they love 3 foods, and then I talk about like, okay, what are those 3 foods? We actually look at them and they contain sugar or a form of sugar, but often high fructose corn syrup. And get this, today in the United States of America, 70% of a child's diet is comprised of these ultra-processed foods. So why is this a problem for complex autism? Well, #1, the rapid sugar spikes and then crashes. And if your child is non-speaking, they may not be able to articulate to you and to communicate to you that they're not feeling well. Yet these foods which are high in sugar and other additives literally cause their blood sugar to spike way up, and then they have a crash, which if we had that, we know the brain fog, we know the fatigue, we know the emotional meltdowns that sometimes can come with that. So our kids aren't immune to that. They're going to experience some of these same things as well. And then we might observe them to be things like self-injury or increased behaviors, things like that, where it's really, really challenging for them. And secondly, increase inflammation. Now, if you've been on my channel and you've seen my other videos, you will hear me talk about inflammation and what chronic inflammation does to the individual's brain, and we call that neuroinflammation, and that can cause other things like brain fog. It can cause dysregulation. It can cause the individual to be very, very uncomfortable, and also decrease sleep. And we know that so many of our kids right now struggle with sleep. So adding in ultra-processed foods isn't going to help support their sleep. It's not going to help support their regulation. So we have to be mindful about what they are eating, because that can contribute to a lot of other things that we may be observing. Thirdly, gut issues. The ingredients that they put into ultra-processed foods can alter our gut lining and actually cause what's called leaky gut. And that means that the things that should be staying in your gut actually can leak out and get into your bloodstream. And when that happens, it can cause things like added brain inflammation. It can cause dysregulation in your child. It can cause stress. It can affect sleep. All of these things are directly related to what you're putting into your body. So these added foods and ultra-processed foods can just really impact your child's ability to get through their day. And then lastly, sensory overload. Things like added food dyes, colors, and additives directly affect how your child is able to self-regulate and calm themselves. All of these added sugars also contribute to that dysregulation. So being really mindful of what you're putting in your child's body can help support or hinder their ability to regulate and calm themselves throughout the day. Okay, so what can you do? Well, step one, let's ask yourself these questions. How much ultra-processed food does my child eat? In fact, how much does your entire family eat? What about stress or dysregulation and anxiety? Do you notice that their anxiety spikes after eating certain foods? What about sleep? Now, does your child have trouble sleeping all the way through the night or even getting to sleep? And what about GI issues like constipation or pain or bloating? And then lastly, do they have challenges with their motor skills? Because believe it or not, eating some of these ultra-processed foods can affect their ability to plan, sequence, and coordinate their motor movements. Okay, and step two, introduce whole foods. Remember at the beginning, I talked about group one, right? So things like apples or avocados or things with just one ingredient. Start to introduce those. Don't take anything away yet, because I know some of your kids have very limited repertoire of food. So that could be related to just being consistent and wanting to have control, or it could also be related to sensory sensitivities. So I always suggest don't take things away at first, introduce things, and be consistent with that, because research shows that it takes about 10 to 12 tries with the same thing before your child may be open to actually attempting to eat it. So be consistent, keep one or maybe two things at first before you move on to something else. And then step three is when you slowly decrease those ultra-processed foods, because that high fructose corn syrup that I talked about at the beginning, that's what those companies pump into those foods so that we all become addicted. But certainly your child can become addicted to those foods and their body actually craves it. So that's going to be the hardest step, is when you're starting to decrease those foods. But take it slow, take it one step at a time, and make sure that you're consistent with introducing some of these whole foods first. Okay, now remember, this isn't about perfection, and you don't have to overhaul everything tomorrow, nor do you have to shop at the most expensive places. All of the grocery stores offer whole food options. But just remember this one shift, moving from ultra-processed foods to whole foods, even if it takes you a while, even if it's at a very slow pace, this will do more for your child's nervous system, their inflammation, their energy level, and their ability to regulate than almost any other intervention. And listen, I know what you might be thinking. You might be thinking, but my child only eats 3 things, or this is not really at the priority list right now because I have a million other things that are more important specific to my child. Now, that's exactly why I created a free resource on how to help you get started and just get through that initial process. And that link is in the description below. So grab it and start this whole journey with your child. Now remember, like and subscribe, and please share this with other families or even other professionals that you might know who can also learn how to best support their complex autistic child. And let me know in the comment section just what have you done that's been successful for your child to reduce the amount of ultra-processed foods in their diet. And let's keep this conversation going, because I know that there are families out there like you who need this information and need this support. The dysregulation, the pain, the sleep issues, it's not just autism. It's often what your child is eating, and you actually have way more control over this than you think. So start with just one food and go from there. Just one. You've got this. Thank you. I will see you on the next video.